All right, Deb, we're going to continue on with your physical assessment.
Okay.
And we're going to move on to the cardiac assessment.
Okay.
Cardiac is all about your heart and how it's working. And so what I'm going to be doing is I'm going to be listening to your heart, and I'm going to be looking to feel all of your pulses to make sure your heart is pumping appropriately. And I'm also going to look at your legs for any edema, and I'll talk you through everything that I'm going to be doing as we go.
Okay.
Okay? So I'm going to start out with a couple questions then. Do you have any chest pain ever?
No.
You don't have any chest pain when you exercise?
No.
Okay. What about any calf tenderness? Now, calf tenderness would be in behind your leg.
No, sometimes my calf muscles are sore with the exercise, but it's not anything that ever stays.
Okay, all right. So that's a good kind of sore for your calf muscles.
Yes.
Okay, all right. I'm good with that. So as we continue on, I'm going to be listening to your chest, and I'm going to raise the bed up so that I don't have to bend over so far.
Yeah,
I want to save my back. You know it. It's real easy to forget to do that.
Yeah.
And then for this assessment in particular, I need the head of your bed to be at 45 degrees. So I'm going to raise the head of your bed just a little bit. I've got a nice little indicator over here to tell me when I've got you high enough.
Okay.
And there we go. We're at 45 degrees. All right. Are you comfortable? Okay. All right, so the first thing I'm going to do, I'm going to put this down so that I don't lean over this either. There we go. So the first thing I'm going to do, that kind of kinks your neck up, doesn't it? Yeah, okay. So the first thing I'm going to do is I'm going to look to see about jugular vein distension.
Okay.
Okay, and as I do this, I'm going to have you turn your head to the right, to the left, that's good. And what I'm looking for is to see if your jugular vein is distended, and it is not. I see flat, smooth, no distension at all. I'm going to have you turn your head the other way, and it is also flat and smooth on that side. So bilaterally, which means both sides, I don't see any distension.
Okay.
And the next part that we're going to do is I'm going to actually listen to your heart then.
Okay.
And I'm just going to take a second to clean my stethoscope here before I use it on you. Okay. I should throw that away. Oh. All right. So I'm going to need to feel on your body so that I listen in the right spot. If I'm in the wrong spot, then I can't hear it as well.
Okay.
What I'm listening for is to hear that all of your valves are working correctly and that your heart rhythm is regular, or I'm listening to see if it's regular or irregular.
Okay.
Okay. So we're going to start right at the base of your neck. And so this is the sternal notch right here. That's where I'm feeling. And I'm going to slide down just a little bit more, and that's the angle of Louis. Now, the first valve I'm going to listen to is the aortic valve, and so from here I'm going to slide just a little bit to the right, and I'm going to listen in between your ribs here. Put my stethoscope in, and I'm going to listen. Okay. All right, so I hear S1 and S2, and the rhythm is regular, so that's good. Now I'm going to go down the other side, and basically what I'm going to be doing is I'm going to feel for your second intercostal space, and the intercostal space means that it's right between your ribs.
Okay.
It's hard to hear over bone, so that's why I want to listen here. And this I'm listening to is the pulmonic valve. Okay. And that is S1, S2, and it is regular there too. And so from that spot, I'm going to go down to the third intercostal space, and this is another way to listen to the pulmonic valve, which is called Erb's point. Okay, S1, S2, and it's regular. From here, I'm going to go down to the fourth intercostal space. And this is the tricuspid valve. Okay, and that's S1, S2, and it's regular. Now this is the point where we get personal. So from this spot, I need to go down to the 5th intercostal space, and I'm going to put my finger here, but I do need to get under your shirt.
Okay.
So I'm going to reach under here, and I'm going to find my finger, and I'm just going to slide over to what we call the mid-clavicular line, which is kind of halfway between your shoulder and the middle of your chest. So I've got my spot right here, and I can't let go because I don't want to have to re-find it again. So I'm going to put my stethoscope right there. Okay. I hear S1 and S2, and it's a nice regular rhythm, so that's good. All right, and you probably are used to us doing that one, because
I am.
That's where we come in and we get your heart rate when
That's
we
right.
listen all the time, isn't it? For your apical pulse.
Yes.
Okay, so those all sounded really good. I think what we're going to do then is I'm going to look at your pulses. And pulses are found throughout your body.
Okay.
And so we'll start with, I'm just going to do my hands again. We're going to start with your hands this time.
Okay.
And let's see if you've got, so I'm feeling for your radial pulse.
Okay.
Okay, and I'm feeling both sides at the same time. That's called bilateral.
Okay.
And I'm making sure that they are strong and equal, and they are, okay? And while I'm at your hands, I'm going to look at your capillary refill. And that means that I'm looking at your nail beds, and they're nice and pink. And when I push on them, I want to be sure that that color returns right away. That tells me that you've got good circulation. Okay, so that's good. And let's finish up on your arms, and we'll do your brachial pulse. Okay. All right, and those are equal and strong bilaterally. That's awesome. And then the last one I'm going to do here is going to be your carotid. So I'm going to feel on each side of your neck. I'm not going to feel at the same time this time because I don't want you to pass out.
Okay.
All right.
I don't want to pass out either.
No, that would be bad. So I'm going to do this. Okay, and that's nice and strong. And your carotid pulse on this side. And the right side is also nice and strong. Awesome. So we've got lots of good things going on here already.
Okay.
I'm going to go down to your feet then.
Okay.
And I'm going to look at your toenails there too. And I'm going to feel your pulses. And I'm going to look for some edema.
Okay.
Oh, look at those socks. I love it. All right. Oh, thank you, because we're going to need to look at your leg all the way up too. All right. So I see that your toes are kind of cool.
I know. I wish I had my warm socks on.
Oh, well, we'll get your socks back on as soon as we can. So I'm looking at your toenails here too, and they also are pink, and when I press on them, they return to pink right away, which means capillary refill is almost immediate. Sometimes with cold toes it takes longer, but in your case it's coming back within the acceptable 3 seconds. Now if you had toenail polish on, I might have to push on the end of your toe to see that, because sometimes if there's nail polish on there, I can't see really well.
Right.
So that's good. I'm going to feel for your pulses down here as well. So this is called the posterior tibial. I said that wrong. This is the dorsalis pedis. This is the dorsalis pedis.
Okay.
I feel it. And this is the posterior tibial. Okay, I'm going to do it on this side too. Okay. Sometimes they're tricky to find, so I just want to be sure, especially with cold feet, that I can find them. And then here again, I'm going to do them bilaterally to make sure that they're equal and strong. Okay, so I can feel both of them. Awesome. And so while I've been feeling that, I looked at your legs for any edema. And so I don't see that you have any edema. If you did, when I press like this, the depression would stay. And then how long it stays would give me an indication of how much edema you had. So that's good. And then additionally, while I'm looking at your legs, I'm looking at your skin to see if there's any bruises or lesions. And in this case, I'm looking under your heel. And it's really important for me to look under your heel because your heels are the things resting on the bed all the time.
Yeah.
And if they rest on the bed too long, they might start to get pressure breakdown.
Okay.
And I don't want that to happen to you. So when you're in bed and resting, what I want you to do is just kind of move your feet every little while. Pull your toes up like that, and then, you know, kind of reposition yourself so that your heels get a break from being on that pressure.
Okay.
All right, so, but before you put the blanket down, let me change my gloves, or take my gloves off and wash my hands. And you actually have a pulse behind your knee.
Okay.
And I'm going to check that one now, and that's called the popliteal pulse. Okay, so to check this one, I want you to bend your knee up just a little bit, and I'm going to feel under here. This one can be a little tricky to find sometimes, so I'm going to adjust your leg just a little bit more. Sometimes we've got to pull it up, sometimes we've got to push it out. Oh, there it is. Yep. Okay, and let me see if I can find this one. I can do them together. This really is the most tricky one of all. Okay. Okay, so they're both there. They're equal bilaterally, strong.
Good.
That's good. Now, for folks that I have a hard time doing that with, I do have a nice little gadget called the Doppler, which
Okay.
listens for the sound of the pulse. But in your case, I don't need to use that.
Okay.
So that's good.
Good.
Okay, so I think we can have you put your pants back down and put your socks back on to warm up those
Yeah.
feet.
I need to get some wool socks.
Okay, and then I have to do one more pulse, believe it or not,
Yes.
and that's going to be
That's
your
an important one.
femoral pulse,
Mhm.
and that's the one that's right by your groin or in the inguinal area.
Mhm.
And so then for this is another personal experience.
Okay.
Sorry about that.
No, that's fine.
But we want to be sure that we cover all of these elements so that we have a good baseline
Yeah.
of your assessment.
Okay.
So what I'm going to do is I'm just going to take my hand and I'm going to kind of go like this, and I'm going to go underneath, and I'm going to find the right spot. Okay, now I can find yours pretty easy. On folks that I can't just find it that easy, I sometimes need to move the blanket down, or I need to expose them a little bit more. But for you, I can find it. So I'm going to do this way and see if I can find it. And yep, they are equal bilaterally, and both of them are strong. So that is good. Okay, well, let me wash my hands one more time. I think that everything is checking out really well with your heart assessment, with your
Great.
cardiac assessment.
Okay.
Your heart rate is strong and regular. Your pulses are all present and palpable. They're equal bilaterally. So I'm really happy with
Great.
the outcome of this assessment.
Okay.
Thank you. I'm going to put the side rail up and put your bed down.
And I'm happy too.
Okay. Thank you, Deb.
Thanks, Sue.